It was combination therapy using aflibercept plus a Tie2 inhibitor and a PDGF inhibitor to enhance the effects of aflibercept alone in the treatment of age-related macular degeneration and diabetic macular edema. This was a phase 1 trial and has led to a phase 2 trial because of the efficacy and safety. So in each group, using, let's say, the PDGF receptor blocker, it was combined with aflibercept. And in the phase 1 trial, there was virtually no safety signal. There was no toxicity. This is in 50 microliters. It's a combined drug. And it allowed the treatment for age-related macular degeneration by stripping the parasites and not allowing them to make the blood vessels mature. They become much more sensitive to anti-VEGF therapy, and therefore leading to hopefully regression of the neovascularization and more sensitive response to anti-VEGF therapy. The phase 2 trial has already begun and is actively enrolling and should have results very soon. Aflibercept has been approved already. The PDGF receptor blocker has not been approved, and this was certainly a trial to see if the effects were additive. There are two different mechanisms of action, and there appears to be a definite synergistic response when you use two drugs together as compared to using one drug. PDGF receptor blocker alone gives you very minimal response, whereas if you use the combination of the aflibercept and the PDGF blocker, it accentuates the response and hopefully will lead to better visual results. It's an intravitreal injection of 50 microliters. So it's the same size medication that we now give for aflibercept and for other drugs. It's not 2 injections, it's 1 injection. Phase 1 trials are really safety trials. You want to know the drug is safe, you want to know the combination of the drug is safe, and you want to see some efficacy if you can. And there was definitely, it showed a biological signal, and it definitely was a safe drug. So in the phase 2, you're going to get much better information as to how effective it is, and that will give you the plans for a phase 3 trial. But this is a very large phase 2 trial called Capella, and it has approximately 500 people involved. So this is a very large trial, and hopefully this target of reducing the parasite recruitment through blocking the PDGF receptor blocker will hopefully lead to the better results. One patient that developed an RPE-RIP, which is a known complication of whether you treat them with anti-VEGF or don't treat them with anti-VEGF. So it was felt by the investigator not to be related, so there was really no safety issue. I think there are patients that even after monthly injections don't completely dry out. So you're hoping with this combination of treatment that you can, number one, achieve better drying, and number two, because you are actually may get some regression of the neovascularization alone by having the become more sensitive and not allowing these vessels to become mature. When they become mature and they have a lot of parasites involved, they really are very difficult to eradicate with anti-VEGF therapy. So the hope is that you'll get better visual results, smaller areas of scarring if you do get scarring, and we'll have to wait and see. Right now, the only approved drugs, and even the non-approved drug that's being used, are all purely anti-VEGFs. So you don't have any additive. The closest that we have right now is Fovista, which will hopefully be releasing data toward the end of this year, beginning of next year, which is also a PDGF, works as an aptamer, works in a slightly different way, and has to be given in 2 different injections. So you're going to give an anti-VEGF, and then you're going to add to that the anti-PDGF aptamer. In this case, it's 1 injection, and this is blocking the receptor. So when you block the receptor, you tend to get a bigger response than if you block the PDGF. We have data from OR coming out that seems to show a response very similar to what Fovista has shown in the past. And the OR drug, which is squalene, basically is part of it is anti-PDGF, and it seems that though it does have anti-VEGF and a few other factors associated with it, it seems to be more of an anti-PDGF effect than an anti-VEGF effect, and that's a topical drop administered twice a day. We want to see what the phase 2 shows, and if it shows an improvement, then obviously we can go to a phase 3, which would, if it shows improvement, should hopefully be easy to enroll, and hopefully this drug will be available, in the near future. Well, we're going to find out a little bit more about the PDGF pathway, which is only one of the pathways I discussed. The other was the Tie2 pathway. We'll find out a lot more when we see the results that will be coming from Fovista, which is an aptamer again for the same, process or same condition of trying to strip the parasites, though this one may have a little better action. I think that, the other drug that I discussed was the combination of the Tie2 inhibitor. Tie2 seems to be found in pathologic conditions. It's found in diabetes. It's found to be upregulated in diabetes and upregulated in macular degeneration. And by blocking this Tie2, you hopefully will reduce some of the sprouting and some of the fibrosis that occurs associated with the disease. You have Tie1 and Tie2 that all go to the Ang receptor, and if you can upregulate or have Tie1, that stabilizes the vessels, and Tie2 unfortunately associated with more pathologic conditions and leakage. So that's another drug that's being used and being tested, went through phase 1 trials, and it was very interesting. In the phase 1, the study was designed so that they did 4 patients in each group. They had, I think there were 5 cohorts in that group, and 4 active treatment with combination aflibercept, and 1 that was just used the drug itself as without any anti-VEGF. And it was very interesting to see that the combination seems to prolong the effect. So by using the 2 together, you may get a drug that lasts much, much longer. And again, these were co-formulated. So again, 50 microliters rather than 2 injections or a subcutaneous injection. And after looking at the results, they started 2 trials, the Onyx trial and the Ruby trial. These are phase 2 trials. The Onyx being for AMD with 360 patients, and the Ruby trial being for diabetes with 300 patients. And both of those are ongoing and will be enrolling. But again, these are, there was no safety signals and there was no toxicity signal. And that's all you can expect from a phase 1 trial.